It is a Tuesday and you're just in time to get your dose of health conversation here on your Feel Good Breakfast Show. Thank you so much for choosing to wake up with us this morning. Now, this morning we're focusing on endometriosis. It is the awareness of it that takes place all around the world during the month of March. And during this time, we honor and show support for about 200 million women worldwide who suffer from this disease. Now, endometriosis can have devastating effects on the quality of life for these women because of the painful symptoms and infertility. But there are so many myths all out the world and around the world and misconceptions around the disease. And we've thought to bring in an expert to tell us the truth about endometriosis. Please, ladies and gents, welcome gynecologist and endoscopic surgeon, Dr. Natalia Novikova. And later we'll be joined by Endo warrior Nizelle the vet. Dr. Natalia, it's so good to have you here.
Thank you for inviting me. Good morning.
I mean, the first question is, of course, what is it that we are talking about exactly?
Endometriosis is a condition when the cells from the inside of the womb, called endometrium, are found inside of the tummy, around ovaries, on the outside of the womb, in the pelvis and other spots. And what happens is that when a woman has a period and she's bleeding, she kind of bleeds inside of her tummy, and it's extremely painful.
Wow. It does sound extremely painful, absolutely. But it sounds like such a rare disease to find yourself having to deal with. And maybe you can just clarify this for us. Who's more likely to get endometriosis? And what can raise the chances of suffering from this disease?
Endometriosis is actually very common. 1 in 10 women suffer from it.
Wow. It's a lot of women.
A lot of women.
Wow.
So it's really, really common. And quite often just thinking that heavy period, a very painful period, is just normal, actually is endometriosis. Women in reproductive age suffer from endometriosis, so from teenagers to women in their 40s. And usually it comes with painful periods and sometimes heavy periods. It's quite common that if your mother or your sister has endometriosis, that you would also have it.
I mean, it's so strange because when we experience period pains every month and all of that, you think it's just part of your cycle. You need to go through this menstrual thing. But how do you then know, okay, this is concerning and I need to go visit a doctor to see whether or not I am suffering from this condition?
If the pain is so severe that you have to miss work, that you have to take a lot of painkillers, it's not normal. You've got to see a specialist.
Wow. I think as a rule, I think generally is that if you are experiencing pain to that extent, the first thing to think and to have to do is to go see a professional, go see a medical professional, because it's better to be safe than not. And you can't just leave it to your imagination. But of course, this conversation continues. We're talking about endometriosis awareness, and it's the month of March with specifically shining the spotlight on this condition and this disease. Connect with us on our Facebook, Expresso Morning Show, SABC3, with any questions that you have for any of our guests that we're going to be chatting to. Right now, let's take a break. We'll see you after this.
It's my Feel Good Breakfast Show.
Welcome back to your Feel Good Breakfast Show. It is the 24th of March and is a Tuesday. It's not just any Tuesday, it is Health Tuesday. Now, this morning we are joined by Dr. Natalia Novikova, who's going to be shedding some light on, you know, a disease that's been affecting a lot of women over the years called endometriosis.
And a lot of women don't even know that they are affected by it. Maybe let's start with the symptoms, doctor, apart from the one that you've already mentioned, where a woman goes into her period, a menstrual cycle, and during that period they feel an excruciating amount of pain. What else could they be on the lookout for? What are the other symptoms?
Sometimes this pain starts a few days before the period comes. The periods may be very, very heavy, and that would be a symptom of endometriosis in the uterus. Women may have bowel symptoms such as diarrhea or pain or difficulties passing stool. They might have urinary symptoms if the endometriosis grows on their bladder.
And just to add to that, to add to that question is, so would these symptoms come through once, or would they be recurring symptoms? So, for example, if every month just before your periods you have IBS, or irritable bowel syndrome, would this happen over time, or would this happen every now and again as a symptom?
It would probably happen every month. It's very much cyclical, and it's a chronic condition, and it interferes with psychological well-being, with mental well-being, with social well-being, because you can't go to work if you're in pain. And
I mean, doctor, the symptoms that you've just mentioned now sound like normal menstrual symptoms, like mild diarrhea, for example, or like pain in your pelvic area. How can we try to manage this if, for example, one, we find that we are suffering from this disease, or, let's start with that.
So management of endometriosis would include a few different options, and it would depend on whether a woman wants to conceive or have a baby, or that's not a plan as yet. Or she might have completed her family. Infertility is also one of the issues that endometriosis causes. And with the treatments, we would start with a hormonal treatment, and it would be either contraceptive pill to start with, or a patch, for example, which we would advise to take continuously and skip the period. If we can skip the period, then there will be no pain and potentially even no bleeding or very light bleeding. So it's one of the options. We can suggest other treatments such as progestins, and that's also hormonal treatment. It's not a contraceptive. One of the medications that was developed specifically for treating of endometriosis is called Visan, and you would take it through your cycle for months and months, and that would potentially stop the periods. The problem with that medication is that it creates like consistent severe PMS with moodiness, and some women just can't tolerate it.
So you're sorting out one condition and delving straight into another. But of course, before you manage it, it has to be diagnosed, right?
Yes.
How do you diagnose it? Where should you go? What specialist should you be seeing as a woman suffering from this potentially, or thinking that you might be suffering from it?
So it's a good idea to see a gynecologist, and potentially a gynecologist specializing in the treatment of endometriosis. And we would start with a history taking, medical history, family history, your symptoms and your lifestyle and surgical history. And then we'll do examination. And at times we can diagnose endometriosis on examination. It will be a suspicion of endometriosis, not necessarily actual diagnosis. And we will do pelvic ultrasound, which will show us endometriotic nodules or changes in the uterus suggestive of endometriosis, or in the ovaries. However, the actual diagnosis of endometriosis is made with the surgery called laparoscopy, or keyhole surgery, which is performed under general anesthesia. You'll have a little cuts on your tummy. We put the telescope in, examine your tummy, and we see endometriosis and excise it, remove it, send it to the lab, and confirm that it's endometriosis.
This is fantastic. Dr. Natalia Novikova, you are such a champion in this space, and we really do applaud you for the work that you do in the health space for women in particular.
And I'm excited that we're going to continue this conversation, our part 3, delving into this conversation and shedding some light onto it. So make sure to keep it locked right here on your Feel Good Breakfast Show.
It's my Feel Good Breakfast Show.
Welcome back, you beautiful people, to your Feel Good Breakfast Show. It is Expresso Morning Show live on SABC3. It's a beautiful Tuesday morning. And of course, we continue to practice social distancing in whatever ways we can, in whatever spaces we find ourselves. And we encourage you to do the same at home. Now, our conversation on health continues this morning. And joining our health segment on endometriosis, please welcome 23-year-old Nizelle Devet, who is a brave endo warrior. I mean, I love her story. She's going to be sharing with us her journey with endometriosis, and just taking us through how it has all unfolded for her and how she's been able to find the bravery and the strength that she possesses and displays on a daily basis. Nizelle, I love your story and I love you. So good to have you this morning.
Thank you for having me.
But of course, we want to know, how did you find out that you have this condition, and when?
Okay, so when I was 13 years old, I started to have symptoms. When I started my normal period, I had this intense pain, and then the old people will just tell me like it's normal to have it. So I was going on for years, it's normal period pains. I I've bleed for 6 months ongoing without stopping. And then at the age of 16, I started doing gynae visits. And then she told me it could be possible that it is endometriosis. And at that time, she couldn't do a laparoscopy because there wasn't enough symptoms of it. And I went on from 16, and then in 2018, 2 days before Christmas, I fainted due to blood loss and was rushed to the emergency rooms. And then the doctor on call then put my vitals up and all that for 2 days, and then he then scheduled a laparoscopy the 14th of February. And then we went in for the laparoscopy, and after that, he came back to me and said, listen here, you have endometriosis. Me at that time was just, oh, okay, I didn't know what it was. And I was like, yeah. So I didn't know what it was. I said, okay, till I'm doing the journey and finding it out day by day what it actually means to have endometriosis.
You have been so brave doing so, and so strong and so courageous, remaining consistent on that path and that journey. And I thank your family for being able to walk with you along this journey. But of course, Dr. Natalia, this is a serious thing, and you hear in a story like this, if someone can pass out, it shows you the severity of it. And I hope there's a cure then. Is there a cure for endometriosis, and will a is there a hysterectomy? What is it? Hysterectomy. That's it. Will that help? Will it cure endometriosis?
Well, hysterectomy will only work for women who don't want to have any more children. And even then, removing the uterus may still leave women with having the pains, even after doing hysterectomy. So it's not a cure, and I wouldn't rush into it immediately. I would start with other options that we've discussed. Pain management, hormonal treatments, and a surgery to actually remove the endometriosis tissue.
Yes.
This is a question for you, Doc, on my side. If you are going through this process and you are taking all the necessary measures that you need to take to kind of manage it, but if you want to carry a child, if you want to be pregnant, how does it work?
Well, there's 2 options. You just try to fall pregnant naturally as anyone else, and if that doesn't happen, we will then advise on either having an in vitro procedure or IVF baby, or having a surgery to remove endometriosis and then continuing to try naturally.
Yeah. Nizelle, rather. Sorry, Natalia is new, Doc. But Nizelle, pain is obviously a constant when you have and you're suffering with this disease. How are you managing it at the moment?
Okay, I have a huge support system at home, my parents and my siblings all. So pain for me is every day, it's my normal. So I put it on a scale from 1 till 10. So I'll say from 1 till 3, I'll still go to work, do my daily task and all that. From 4 till, say, 8, I'll notify my parents or anyone close to me, work colleagues or anything, just to let them know, listen here, I am in pain. Should I pass out, they need to take me to the hospital or anything like that. And anything from 8, I'll make my way to the hospital, or most probably just keep myself home at home.
I'm so much more conscious. I love
Absolutely. I mean, for people who are also going through the same thing as you are, what kind of lifestyle changes or tips would you advise that they need to heed of?
Okay, I have other chronic illnesses as well, but I take, usually I stay away from food. I can't eat like gluten, red meat, alcohol, nuts, anything like that, sugars. And what I normally do to keep with myself like natural stuff is I take a hot bath and keep myself warm. And yeah, keep my feet warm all the time.
Thank you so much
all round.
for sharing this. I love this. Dr. Natalia, you've been so insightful, but of course, Nizelle, your journey hopefully has inspired so many women who are watching right now, who are going through exactly the same thing. Apparently 200 million or over 200 million of them across the world. And so this month of March, we shine the spotlight on this disease, and we say that, you know, we support everyone going through it. And of course, learn more about it. Go online, find the information, visit your gynecologist if you feel like you may be presenting with some of the symptoms. All the best to the women out there.